Hi everyone, welcome to this session on managing skincare through cancer. Like I said, just to flag that the session's being recorded, but yeah, we will edit out any questions you ask if that makes you more comfortable. Also, if you want to come in on audio, that will be part of the recording, but we'd love to hear from you throughout the session. I'm really excited to introduce you to Fiona Murphy, who is an oncology skincare specialist, and she's kindly come along to sort of take us through this session. Can't wait to hear what she's got to say. I'm going to let her introduce yourself properly, so I'll hand over to you, Fiona.
Thank you so much. Hi everyone, it's really good to virtually meet you all. Just a little bit about myself. My name's Fiona and I am the creator of Sparkle Through Chemo, which I specialise in oncology, skin and nail care. So a little bit of background about myself. I was diagnosed with ovarian cancer when I was 25, and my previous job was I was always a specialist in skincare, mainly rosacea, pigmentation, acne, scarring, that kind of field. But when I was diagnosed, I realised, one, there wasn't very much for people going through treatment, if at all, with skin reactions. And the beauty world was quite cold towards cancer patients. So generally the rule is that you can't have any beauty treatments until you're 5 years clear. And when I did some research, I was part of my research that actually 72% of people going through treatment or post-treatment experience some kind of dermatological side effect, which is a huge percentage of people. So I really thought, okay, this is something that I feel really passionate about and really strongly about. And I went and did my postgraduate in oncology, skin and nail care therapies, and Sparkle Through Chemo was created. It is purely for people that have experienced cancer, wherever they are in that, whether they've been diagnosed during treatment or post-treatment. And I offer an array of bespoke therapies to give personalised skincare. There's not one set reaction or skin health that one person deals with. It could be an array of different ones. But generally, it can be quite an isolating experience when it comes to reactions with skincare and through cancer. A lot of the time, from my experience and from feedback, it's not very well validated and kind of pushed to the side a little bit, when actually, we get our kidneys function checked, our liver function checked regularly when we're going through treatment. But our skin is actually our largest organ. And it's our first defense of germs, bacteria, viruses, and it gets very little attention as we're going through treatment. And it's really vital from a healthcare point of view that we keep our skin nice and strong, but also from an emotional side, that there's so many changes happening, and it can really take a huge knock-on effect on our self-esteem, our body image, how we socialise and interact with people. So that is part of the role as an oncology skincare. It's quite varied, and it's got a mixture of the science and the holistic side. So we're treating the actual physical being, but also the emotional being going through that. I don't know if any of you have had any experiences with skin issues. If you have, maybe you want to pop that in the chat, or say if you've experienced anything and how you've managed it, if at all. That would be great to hear. If not, I'm just going to go through some of the larger side effects that I see quite a lot, and hopefully it will resonate with you a little bit. And again, feel free to put anything in the chat box, or just interrupt is fine. All is fine here. So one of the biggest issues that I see a lot of with people is photosensitivity. So there are certain chemotherapies, PARP inhibitors, immunotherapies, and to a certain extent radiotherapy can cause the photosensitivity on the skin and the nails. So this could present itself in a rash on the skin or a hyperpigmentation. So with that, we need to, it's really depending on the drug that you're on to how your skin is going to respond to that. So again, when I meet you, or if I meet you or meet the person, I will go through exactly what you're on. And by that, I'm able to put together a more bespoke plan to help minimize these effects. What we do know is that people that manage the effects prior to them happening generally tolerate treatment better and for longer. So the outcome is much better, which is fantastic. But there are different things that we can do. So, for example, some of you may have, depending on the cancer that you've had or you've got, might experience real issues with the nails. So that's something that I treat a lot. So you might find that they get discoloured and they go dark. They may go a bit turquoisey, or they could also look a little bit like you've been smoking 30 a day. And this is hands and feet. So, and that is a typical UV reaction of photosensitivity. So from the sunlight caused by a drug or a PARP inhibitor or a maintenance, so a tamoxifen type treatment that you could have. So previously, people used to always wear like a black nail polish, and they were always very much identifiable that they were going through treatment because they had this black nail polish. There is actual evidence behind dark nail polish. So what that does is it creates a barrier from the sun, and it works like sun cream for your nails, which is why they were using black. But we now know it just needs to be opaque. So it just needs to be a coloured, and it's better to start using that. So I've got a few colours here, you can see. So they don't need to be black at all. So these are like, can you see? Yeah, so you've got like a corally colour here, you've got a glittery pinky red, and then you've got like a more of a summery orange colour here. So I use the brand Zoya. They are toxin free, cruelty free, and they're vegan, and it allows you to protect your nails but also keep your own identity, because wearing something like black is not many people's identity. It was very Chanel 2002, but we kind of moved away from that since then. And what I recommend we do with that is, from the first point of your treatment to 8 months post your last infusion, you are likely to experience some nail toxicities from UV rays. So a taxane treatment, which is quite common for breast cancer, ovarian cancer, lung cancer, and they tend to do that up to 8 months post. So you could literally go to bed 5 months post your last infusion and wake up with a turquoise nail. That's quite common. It doesn't look nice, but actually it's not particularly dangerous. It's just a reminder of your treatment, but it's toxins coming out. What we really need to do, and why the importance of a polish is important, is the UV light can damage the actual nail plate, so it lifts. And because the immune system's suppressed, you're more likely to get an infection or a fungal infection and lose your nails. But there's so many different things that we can do with that. So, for example, I am a massive fan of Epsom salts, magnesium salts, and I use them in a lot of treatments. And they are really good for a whole array of skin issues, from dry, irritated skin to when you're getting that achy pain, muscle joint fatigue. And the great thing about it is you don't need to have a bath. So I know if you've got like a PICC line, or you're having your, intravenously, or a port cath, you don't always want to have a bath because it's just a faff really. But all you need to do is put 2 cups of Epsom salts into a bowl for your feet, and a couple of drops of oregano oil. And this is an aromatherapy oil, and it's a natural antibiotic and antiviral. So if you're feeling that your nails are slightly starting to lift, then this helps to keep any infection at bay naturally. You literally only need to have 2 drops of this, though it's not like you're putting vinegar on chips. It is an essential oil, so you literally need 2 to 3 drops. And if you're wondering, yes, it is the same thing that we have in our pizza, but unfortunately eating the pizza won't help our nails. So we're going to have to do it topically with the oregano oil. And you can just dip your hands and your feet in a medium temperature water for 10 to 15 minutes. It also helps if you've got any neuropathy, just to soothe those nerve endings. And there are different things we can do with oncology aromatherapy to help with neuropathy, which I can go into a bit later if that resonates with anybody. But you can do those soaks 2 to 3 times a week in a medium temperature water. So to get the Epsom salts to melt, it needs to be put in at a higher temperature, but you need to just let that cool down. Treatment basically puts our skin into a resting phase, it sleeps. So we're not producing the fatty acids, the collagen that we would normally be. The treatment's affecting how our DNA is replicating our cells for our skin. So we kind of need to give it a bit of a boost. So if you're going to be using them in the Epsom salts in a water base, it needs to be a medium temperature. So we're not producing as much oil on our skin as we normally would. So our skin, in effect, becomes slightly thinner. So we don't want to make that any more sensitive or irritated. But it's a really nice thing to do, just to put your feet into some Epsom salts for 10-15 minutes, maybe put a nice meditation on, or, you know, just a bit of you time, or you can do some work on the laptop, whatever resonates with you. But you can do that up to 3 times a week, and just make sure that when you take everything out, that everything's nice and dry, especially if your nails have started to lift. So just to pay a little bit of attention to that. But Epsom salts for me are a bit of a wonder, and they're quite inexpensive. They're easy to get. Just press that box on Amazon and it's right at your house the next day. I use Westlab Epsom salts, and they have a nice big array of different types that you can get. What I would suggest you do, and this is with all products actually, you may have been using the same products for years, but the actual treatment can change how you react to products. So it's really important to do a patch test. So to do a patch test with Epsom salts, you just need to put a small amount in a cup, let it melt, and then test. Now, the best place to test actually is behind your ear, because your skin is thin and you're more likely to show a reaction than if you were to put it on the inside of your arm, where the skin is slightly thicker than behind our ear. So once you do that, and like I said, you can carry on and do those for a couple of times a week, and that will really help, especially if you've got, you know, joint and achy pains. We know that treatment and post-treatment, we're lower in magnesium. So it's a great way of getting that back into our body transdermally. And, you know, it's always quite nice to sit there and have a soak and feel a bit pampered. But actually, the results that we get are cumulative. So the more you do it, the less you'll start to experience the side effects. So that's quite an important one to do if those resonate with you, or an issue that you have. I would probably start, if you're on active treatment, with just plain Epsom salts. And then once you finish, you can become a little bit more experimental. So, for example, Westlabs have got a really nice gin and tonic Epsom salt bath. I would probably wait until you finished active treatment and before starting that. They also do ones with lovely aromatherapy oils in. But again, I would wait until you finish treatment and just keep everything as basic as possible through active treatment. So going through some of the treatments that I offer, and what I've done is everything is bespoke. So for example, I could have 2 of you come for a treatment with me under the same bracket, so a holistic facial, but you'll actually receive very different treatments from each other. Why is this? When you go and have a facial and someone follows a program of 12 or 15 steps, it's not bespoke to that person, and it's actually quite superficial. I don't want something superficial. I need to be getting your skin what it needs. So it's more bespoke, more prescriptive. So for example, if you've lost your eyelashes or your nose hair, you might find that your eyes are streaming and that your nose is really burning, and it's such a horrible side effect. It's one of those ones that kind of push you over the edge. You expect the bigger side effects, but those little ones become really irritating. And so what I would do with that, we would do some acupressure, which I'm going to go and show you a little bit later on. We're going to do some acupressure together that you can do at home, and some lymphatic drainage to really help get rid of that excess fluid, to stop the burning and to stop the running of the eyes. Because what we don't want to do is put cream and oils near our eyes when we don't have eyelashes, or we have minimal eyelashes. You're more likely to have an infection and to wake up with really swollen eyes because your body's not able to manage it. That's what eyelashes are there to do, as much as they're there to, we put mascara on to make them look lovely. They actually have a functional purpose as well. I have eye chemo, so I get injections in my eye. So these eyelashes are not mine. They're glued on to give me some eyelashes, otherwise I wouldn't have any. So I'm always having to do this on myself and at home, and you can literally take 10 minutes out of your day or into your routine to be able to do that, and it makes a huge difference. So I'll definitely go through that routine with you in a little bit, so you can take that away and get some benefits from that as well. With the skin, the most important thing that we can do is to keep our acid mantle barrier, which is the outside layer, strong. And because, as I said earlier, that it affects the DNA as it replicates, it makes that harder to do. So what products we use and how we use them make a huge difference to our skin. And although I'm on a camera now, you can see my face, I'm actually talking about the whole body, including the scalp. And so it's harder to see that on Zoom, but yeah, I'm talking about the whole body. So we really need to make sure that our skin is kept lubricated, our sebaceous glands get withdrawn, so we're not producing that, which gives our skin elasticity to move. So you'll find when the skin gets thinner, because of the less collagen, it's almost likely to break because we also don't have that elasticity to help the skin do what it's meant to do. So there are some brands, and I said that I would give some information at the end where you can click and you can find them. But one of the brands that I use is called Mugu. Some of you may have heard of them already. And 4 of those products are available on prescription, which I will give to you the names of them that you can get, and then you can go to your GP and you'll be able to get them. So Mugu are an Australian brand, and it's a bit of a strange name actually. One of the creams is called Udder Cream. So the story behind that was actually they used this product on cows with mastitis, realised how well it worked, and then it got formulated for human use. So a lot of people use it for radiotherapy and during treatment and post-treatment as well if your skin's a little bit fragile still. We expect the skin to stay fragile to up to 12 to 18 months post your last treatment. So it's not a case of, right, that's the end of treatment, next week my skin's going to bounce back and everything's going to be great. That would be the ideal thing, but actually we kind of need to keep it nice and strong the whole way through. Reactions are really common, and I know that Claire is probably going to show a reaction. So this patient, she has stage 4 bowel cancer, and this is an allergic reaction to FOLFOX chemotherapy. So you can see her acid mantle on her skin has completely broken down, and actually it took me 45 minutes to take off her makeup. And it was difficult because her skin was basically cotton wool. There was nothing keeping it together. It was very difficult. And she's obviously in a lot of pain. It's very sore, and the risk of infection was high. And it got to the point where they were going to have to stop her treatment for her skin to get better. She's on continuous treatment, and I think now she's done chemo 125 actually. So she came to me, and it was obviously a bit emotional, and I think it takes a lot for people to, one, take off their makeup and reveal themselves for how what treatment has done to them. And I always find that I am very lucky that people trust me in this way, whether it be taking off their wig, showing their scars, or in this lady's case, the most vulnerable state, her makeup. And she's a primary school teacher, so that's quite a tricky combination generally. So what I did is we went back to basics. My main point with this was to reduce that inflammation around, especially around her mouth, the forehead, and across the cheeks, and to restructure that skin acid mantle barrier. So we actually only used 3 products. There was no massage involved. Her skin, like I say, was cotton wool. And once I'd removed her makeup, she said it's the first time that her skin's not bled when she's had her makeup removed. So that's just to show you how fragile that her skin was. I saw her weekly for 4 weeks, and this was the result on week 4. I think Claire's going to show. And it just, yeah, that's the difference within, you know, a month really of myself and her working together to reduce that inflammation. And that was done purely by reducing the inflammation and restructuring the acid mantle on her skin. So my promise to her was, at one point she would leave the clinic without wearing any makeup. And it wasn't on this session that she did it. It took a few months, but she did, and she felt confident enough to be able to do that. And I'm really proud of her, because I think she's done an incredible job to have to do a lot of home, care herself and refer to me for the maintenance treatment. But as a team, we really managed to get her quality of life back, and for her to just feel more like herself, which I think is a huge, huge part of all of the skincare, male or female. Regardless, I treat both, and it's pretty much an equal amount of both that I treat. It's not one more than the other. The difference, I would say, would be women are more preventative, as men generally come once they have a problem. That would be the sort of difference. But this patient here, she still comes to me now, and we're 4 years down the line, and she's, like I said, she's on continuous treatment, so we have ups and downs with her skin, but actually on a whole she's doing incredible. So yeah, that was one of the more difficult, challenging ones, not necessarily from the outside but for the inside, because to see how much that devastated her as a person was really difficult for her, and to try and then make her feel like herself and recognise herself. So there's a whole lot of different aspects to this. So within my therapies, we will do, like I say, the more science, clinical based side of things, but then I will also do a lot of mindfulness exercises if that resonates with you. If that's not your type of personality, it generally stays quite scientific and we go through that. But if you quite like the Reiki to be added, the affirmations, crystals, and all my kind of woo-woo stuff that I love, which does have science backing, I'd like to add, we can all add that in as well, really. They are really bespoke treatments, and that's just one of the ones. I don't generally get a lot of patients that let me share. They don't give me permission to share, which is completely understandable. But that is one that I was able to do so. And I think actually, in contrast, we can see that these aren't necessarily beauty treatments, but they're actually skin health therapies that are needed to help people throughout their treatment and beyond. So was there any questions? I thought I saw something come up before I babble on.
There was a question. The question is, I've suffered various skin problems since being on treatment: rosacea, acne, swellings and spots on the trunks and legs. these have settled down since seeing a dermatologist, but now I have some sort of infection between the fingers, which is very dry, sore and itchy. It's red, starting with small red dots and becoming extremely dry. She's tried lots of antifungal, antibacterials, etc. Would Epsom salts help this?
Yeah, absolutely. I would do the Epsom salts, make sure that the temperature's not too warm, and I would put 2 drops of the oregano in that for sure. That will really make a huge amount of difference. And then once you come out of that, I would use a hand cream. There's 2 different ones that's in my head. There's if you email me a picture, then I'll be able to make more of an assessment if you feel comfortable with that. But there's the Salcura one, which let me see if I've got loads of boxes of stuff around me. If any of you love products, you'd be in heaven right now. So there's the Salcura one here. Can you see that? Yeah. So that's really good. And it's quite thick. It's a natural hand cream, and it's been created for those with eczema, dermatitis, psoriasis and real skin reactions. And you can use this. It's also light enough so it doesn't actually feel greasy on the hands after a while, so you don't need to be sat there like this for 20 minutes before you can do something. I'll give you some information on that because I'm pretty sure Salcura are giving a discount, but I just need to clarify that. I think I said that to Claire earlier. Or we have, where's my other little box of goodies? We have this one, Inica. So this one here is Inica. So the reason why I think this might also be a benefit, if you can see it, is that it helps with photosensitivity. So UV rays, which could also be what's creating a reaction on your hands from the treatment that you've been on. So the hands, it can be quite photosensitive, particular hands and feet generally hit that a bit more. So this is an avocado infused, or I can't say, infused one, which might also be really good. So either of those might be good, but if it sounds like it could be more photosensitivity, so it could be this. There are also some gloves. I'm trying to see if I can find ManiSafe. So she has created these UV gloves, protecting gloves. So you know when you see ladies going have the gels and they put their hands underneath the lamps, the rays that go onto the hands actually damage the skin. So I met Candice actually at an oncology appointment, would you believe? And we started speaking, and I thought these would be great gloves for people with photosensitivity from treatments. And they cover everything up until the finger, like the nails, but they come in like leopard print, they come in black, they're like quite funky, so they don't look medicalized, but they're also really great if you're having issues with skin breakdown and issues in between the fingers. They can act like a second skin, plus also help reduce the UV protection. So they're UV 50 blockers. 1 second, because I'm going to cough. I'm sorry. I have to. Right, I'm back in the room now. Sorry about that.
Problem. I'm just saying, I've just put ManiSafe gloves in the chat, but also you say that people can email, so I've put your email in the chat as well.
Please do.
You're
yeah,
happy for people to email you directly with
those
products, maybe the specific
absolutely, because I know when you're doing something like this, it's quite personal. I wouldn't want to start divulging all my information in front of lots of people, but I really want you guys to get the best of this, so just feel free to email me. I get emails and pictures of all sorts of weird and wonderful things, so I've seen it all before, so don't worry about any of that, and I'll get back to you and be able to sort things out that way for you, if that feels a bit more comfortable for you. But
I just say there's another question in the chat as well, if you're happy to.
Please do.
It says, I'm amazed at those results of those photos I think we showed. She said, I had a massive sudden acne flare-up after my first chemo, and they put me on clindamycin lotion, which has been working well, but how long generally should I continue that? I'd like to use less harsh chemicals on my skin.
So depending, so when you've had a reaction like that, so there's different types of reactions from chemotherapy, and that sounds like you've had an allergic reaction to it. Not something that will stop your treatment. It's quite common to have allergic reactions from chemos. So what I would do is, I'm not sure how long you've been on that, but I would start to introduce a more acid mantle repairing regime onto your skin. So this is where I think Mugu products would be fantastic for you. You can get their facial wash and their face cream, scalp cream, and a sensitive balm all on your NHS prescription, and you can start to rebuild your acid mantle, which is when you stay on what you're on now, can actually end up having the opposite effect. It's great for the allergic reaction side of things, but you're not restructuring the actual acid mantle of the skin that we need to really embrace to get that stronger, and to have less reactions. So you can come off of it a little bit gradually. You'll have to speak that through with your team and be like, well, actually I've got this X, Y and Z in place, and there might be a bit of a crossover between the two, but I would say it's really important to now start getting that in place and use it all over your body. So as much as some creams are like, this is for your eye, this is for your elbow, generally you can put most things everywhere, and with Mugo you can use it everywhere as well. I'd also recommend getting a konjac sponge. So konjac sponges are natural and they're great for removing the dead layer of the skin, but they're non-abrasive. So you can literally, they come in like round ones or a body one, so you can get one for the face and one for the body, and you can just use your facial wash with that. I would use it every other day, maybe every third day, depending on how fragile your skin is. It is non-abrasive, so it can't take off anything it shouldn't, so you're not going to end up taking layers of skin off like you would with a facial scrub or a face flannel. They're so gentle, but to remove some of the layers, the dead skin, will allow your product to work better because it can actually get to where it needs to, but without being too harsh on your skin. And if you have lost your hair or you're losing your hair, it's really great to incorporate your scalp into this routine, which I know is very emotive. I'm not here to say cut, shave, do whatever you want with your hair, but it's really important that the scalp health is really well looked after. So if you are worried about your hair coming out, if you use the pads of your fingertips, get some coconut oil, so it's antiviral and antibacterial, and just place it onto your scalp and just massage it. But if you see where I'm moving my hands, I'm not actually taking contact off of the scalp, so it's not actually going onto my hair, it's going straight onto the skin of the scalp. One of the things that I see a lot of post-treatment is where the scalp's not had good scalp health, and we end up with cradle cap. So you're wanting your hair to come back as quickly and as lovely as possible, but we've got to then deal with a fungal infection, so which is distressing, and it takes longer because of the suppressed immune system. So everything, with the konjac sponge, you can just really take it in between your hair if you've got some on your head, and if you don't, then you can just take it everywhere, but there's multi-purposes use for it. I'm just gonna have another drink.
The person who asked that question said thank you. I'll definitely do that. She's only got one more chemo, so hopefully you can get started on it soon. Well done for getting through your chemo.
Yeah, exactly. You've done well to do that.
Absolutely. So we've got another question here, if you're happy to take this.
Yeah, please do.
I'm just going to read these out. Hello, I finished chemo in August 22. During chemo, I had a skin reaction which mostly affected face, neck and chest. Since finishing, I've been left with redness on my left cheek and broken capillaries, and a red scar under the left side of my lip. It just appeared. I think it's an old scar which has just come back. Okay. Would a laser facial be required to repair this, or is there something else? I don't want to pay for something that's not necessary. Like you said, it's a need for my skin, not a beauty treatment, but I don't know where to start.
So with the laser facial, definitely not for now. So your skin will change and you won't get an accurate assessment of what your skin's going to be like to about a year. So this could all start to really minimize within the next year, so you could have something that actually you don't need to cover up the broken capillaries. I'll give you a link. It's a product that I use a lot. It's called Rosalique, and it is specifically for that. And it covers up for rosacea, broken capillaries, redness on the skin. The scarring is slightly different. We can use something slightly different for that. But for the redness of your cheeks, Rosalique is actually a 3-in-1 treatment. So it helps reduce inflammation. It covers the inflammation on the skin, and it also has an SPF 50. And just so you're aware, it comes out bright green. So when you look at it, you're thinking, oh my God, what is she actually doing to me? If you play, I can go through this with you. We can, if you get it on a video call or whatever, but you literally put it onto your hand. Once it oxygenates, it changes colour slightly, and then they have a brush. So, and then you just apply it, and then it goes to any skin colour. So you're not going to look like Shrek. And it absolutely is incredible for what it does. So it will help to treat the broken capillaries and help them to repair themselves. Plus you're going to get that SPF protection, which also makes capillaries more dilated. For the scarring, what I would suggest that you use for that is, again, make sure you're wearing a high SPF, but you might want to use a product called Tamanu. Mugu, one of those. It comes in a drop. So you literally, it's great for scarring. And again, you can use it anywhere on the body. It doesn't necessarily have to be for your face. I personally would be focusing on restoring your skin, because we actually don't know where your skin's going to get to in sense of where it's going to repair itself to. August now, we're in November. So as much as I know it's really frustrating, because I just want to get back to normal, from a treatment perspective, it's actually not that long for your skin to be at a balanced level, to be like, actually, this is your new baseline. It's too early for that. And lasers certainly wouldn't be something that I'd be recommending for you right now at all. If anything, definitely look at the Rosalique, because it's great stuff. And the Tamanu, it comes in a dropper. You just put some on, massage it in, and then you can just carry on with your normal routine. But it's too early, is my opinion for that. You could damage your skin more.
That's really helpful. Thank you. So so you said that. Brilliant, thank you. I've already started Googling Rosalique, so there we are.
Yeah, Rosalique is one of my favourites. I actually, the patient that you showed the pictures of, that's her go-to. So she will do her normal routine. She will put on her Rosalique and then her makeup on top. So and she's one of the ones that use it all the time. I personally use it too. I love the fact that it has the SPF 50 in it, and it makes a really good primer for makeup. So multifunctional, which is what we kind of want, right? Rather than lots of different things. Well, actually, I'm the worst person, because if I could have 50 different products, I'd be in heaven. But I know that's some people's idea of hell. So to keep it minimalised. But yeah, they were definitely ones that I would use for that, for sure.
That's great. Oh, so someone said, how do you spell Rosalique? I think can you see that in the chat, Fiona?
Let me look.
Rosalique.
Yes. Yeah, that should come up. Yeah.
I think we're spelling it right. Yeah.
Yeah. Because you've got, I've done something stupid. Yeah, I'm now on Rosalique. So yeah. Right,
so I've put the link in there. It's a very long link. Sorry about that, but it's I think it should take you to the.
Okay, I didn't turn myself off there. I was quite well. I got out of that.
Yeah,
nicely. I was like, oh gosh,
nicely handling the
disconnect.
So if anyone else has got any more questions, do put them in the chat. I was just wondering about because we have a lot of people who, like, hormonally are thrown into early menopause sometimes, or temporary chemical menopause with treatment. And that was certainly my experience. I went through treatment when I was 17, 18, and so very difficult to know what my skin would be, I'm wondering whether there's any specific advice for people with that, or is it about personalizing the care again?
It is personalising the care. However, there are things that we can do for that. So actually, we know that we need to keep the skin far more hydrated. One, especially if you're experiencing hot flashes, you're going to be losing a lot more moisture that way. And because you've got into a surgical or medical menopause, your estrogen and have literally gone from here to here. So the trying to balance that out can be quite difficult. So what we need to do, I would do this is when in a facial or a treatment, I would be doing acupressure to help with hot flushes, to help with the hormones, and also product wise, less is more. Right. So if you've got a hormonal breakout, we know that we can try and reduce that inflammation, but it's going to be more managed than completely get rid of for a particular amount of time. Your body has to adjust. The main thing is not to go to acne products and to actually treat it like a reactive skin. So really sensitive, cocooned, rosehip oil's fantastic, rather than really harsh sebaceous. All you're doing is literally stripping your skin. Then your skin's trying to produce something, and in doing that, it's then reacting. So you end up with twice the amount of hormonal breakout than what you would if you hadn't done that. So things like a spray that you can put, or that can go over your makeup to just help keep you calm when you're having that hot flush and you just want to stick your head in the freezer. That's really very good for it. Making sure that you know that your skin is actually going to be a lot thinner than what it was, because of the collagen. So we can use products that have fatty acids and omegas in them, which is everything that we want to do that. For the body, coconut oil is amazing. Right. Ones that most people have in their cupboard at home somewhere. Coconut is just full of omega and fatty acids, which is what we want because we're not producing the collagen that we need to keep that skin nice and plump and strong. So that's really good to do that. But there are some really nice facial sprays that you can get. Salcura do a derma spray, and it comes in a serum or an actual spray. So if you're having a hormonal breakout, I would probably go for the actual spray rather than the serum, just because you can use it over everything and have that continuously throughout the day, and that will help the skin just to settle out and balance. Sometimes it's an overnight miracle and it works. For others, we're on it for a bit of a long haul, but to make it manageable is what we want, and so it doesn't get infected. So it's those really inflamed, difficult, painful blemishes on the skin, we can minimize that.
That's really helpful, thank you. And delightful going around smelling of coconut too.
Yes, I mean, it's just one of those things that you think, oh, most people have it, and it's great for nails, it's great for scalp, it's great for skin health. I mean, you can't really go wrong with it unless you don't like coconut. This is true. Then that's unfortunate.
So we've got more questions. I have a question about the scar oil that you were talking about. The question is, would that work on surgery scars as well?
Yes, it does. So you can either use the one from Mugu, which comes in a dropper, or this is what I've been using on my skin this week, is the Tropic Tamanu Balm. Let me see that.
It's a bit blurry, I think, but that's it. Yeah. Perfect. Yeah, Tamanu.
There we go. So I've been using this on my skin this week. So I said to Claire before we started that I had surgery on Monday, so I know that my skin is literally going to be dried out from the anaesthetic, and thankfully I was pumped full of fentanyl, which I quite liked, if I'm being honest, but my skin will not like. So I've been covering my face and body in this all week. It's green, and it smells very earthy. Fantastic for scarring and fantastic for post radiotherapy treatments. Really, really good. I quite like an earthy smell, but that's each their own. But the results with this is incredible, and it's natural, and it's great for knitting back the skin for scarring. So that's one of my go-tos. I absolutely love. As you can see, I've nearly finished it. So that's one of the ranges. Yeah,
Also,
because sometimes people don't like a serum that drops. You might want something that's a bit more solid that you can liquefy. So there are different places of getting these things, that you're not just stuck to using, you know, a liquid dropper if you can be a bit messy with it. You might want something you just put on and liquefy and you can put on.
That's
So
fantastic. And just to say at this point, thank you so much for coming to talk to us after having had surgery. We just want to enormous
pleasure.
props for that.
I hope
just a
I'm
couple
making
more.
sense.
Yeah,
when I watch this
absolutely. You're
back.
doing amazingly well.
Thank you.
Got a couple more questions for you here.
Yeah.
So my skin is much drier now after treatment. What do you recommend for a skincare regime from combination to dry skin?
So what I would use is, for that, I would use the cleanser from Mugu, which is really nice. You can get that on prescription. And what I also would use is Inica. So they're 100% natural and 80% certified organic. And what I love about them, this is a night cream, sorry. I use these in my treatments. And just to mention, for me to use a product within my therapies or in my clinic, they go through really vigorous checks. There are certain things that I can't accept or don't want in the products that I use. And there are certain things that I do. So there's quite a lot of back and forth conversations. I check absolutely every single safety data on every single product to make sure that I know it's suitable for the treatments that I'm giving. So I'm not sponsored by anybody. I turn lots of companies away. I make sure that they're definitely 100% right for what I want and for what I would hope that my people that come to me would like as well. So just to put that out there. Back to what you actually asked. So the Inica this is the face cream, and it's maca root, and I love it because it comes in a day cream and a rich day cream. So you have the choice. So for your combination, I would go for the day cream, which would be a nice one. You can, I don't know, it's really difficult because it's a bit blurry, but it's a nice consistency of a product. So I do that. Can we see?
Yeah.
Okay. So you can see it goes in quite nicely onto, and it smells lovely as well. And as much as it's not the reason why I like them, one thing that I had a lot of from patients that I see or clients is that they love the fact that this didn't look like something for a cancer patient. It looked like something that someone could just have, and it didn't need to be special, which I hadn't really thought of that, to be honest, but that's something in the feedback that I've had quite a lot of. So I would use the day cream. I wouldn't go for the rich, I would just go for the average day cream. And they have a really nice serum. Let me just grab it. Here we go. Sorry, I was organised. And I can speak with, if you're interested in getting some samples of them, I know Inica will send them out to you. So just send me an email with your name and address, and I'll get them to send them out to you so you can try. You'll probably get a little box like this, and it has a cleanser, face cream, day cream, serum, and this is the serum. So in a little tester stand of it, and it's great because again it's sort of the omegas, the fatty acids, and it also helps with inflammation. It's got pomegranate, so you can actually use this throughout treatment and post-treatment, which is really nice. They do have an aromatherapy type smell, so if your smell is a bit sensitive during treatment, I would probably stick to the Salcura or the Mugu. If your sense of smell is not too bad, then you can definitely use this, and you can use this post as well. I've also used a couple of drops of this where my feet's got a bit dry, and it's been incredible. So yeah, this is the Photo Active Oil. So if you want some samples of them, please just email and I'll get Inica to send them to you.
That's amazing. Thank you.
So
I've just got one more question that probably could fit in one more before we have to finish. So someone says, I'm on continuous treatment and my nails are quite weak. So back to what you were talking about at the beginning a little bit. Do you recommend a product that might help strengthen nails?
So what would be really nice for you to do is, there's a couple of things. One, a glass nail file. So this makes a huge difference. So a normal emery board, when you file your nails are actually made up of loads of little layers, and it leaves them open. A glass one, even if you seesaw, will seal it off. So it gives it that extra bit of protection anyway. So if you tap your nails, it's not going to crack in the same way that it would with a normal emery board. So that's one really good tip for doing it. The other one that I would recommend is shea butter. You can get that from Mugu, and you can just put a layer over your whole hand and nails. What I do offer is a nail strengthening treatment, depending on what treatment you're on, to see if you're suitable. That's something that we could have a conversation about. And it's a nail strengthener, but it does require UV lamps. So it would go under, but I'd need to have that conversation with you. But I would definitely get the shea butter. Ask if you can take biotin, which is a vitamin supplement for hair, skin and nails. That could be really helpful for that. And just to, again, make sure you can do the Epsom salts with that, keeping your nails nice and strong, giving them good health, and you keeping them short. I know brittle nails are really annoying because everything you touch, getting keys out your bag, it comes out. I would encourage you to use a dark polish or a polish of some description. I think you'll find that will definitely help. Because the Zoya is breathable, your product can penetrate through the nail, so it's not going to dehydrate the nail. Any of the treatments that I do, we don't dehydrate or scrape the top nail, the layer off. It's all for rebuilding and restructuring. But there are a couple of the things that I would start off with. And if you need some more help from that, there's loads. So we're not just stuck with that, but to start off with, I would definitely get the shea butter, the glass nail file, and start putting polish on your nails.
That's great. Thank you so much. So I guess if we can just finish off, you mentioned to me that you're happy for people to email you, obviously.
Yeah,
I'm
absolutely.
going to tell people a little bit about how they can also come and see you if they fancied it.
Yeah, absolutely. So what I've known Shine probably since I started myself, so a really long time. And what I wanted to do was, my whole ethos is when someone gets diagnosed, I want them to have access to someone like me, as part of the MDT team. So far, I have become the first oncology skincare specialist in a UK hospital. So I started at the London clinic last year. I went for a job as a complementary therapist because obviously during COVID everything shut, and they actually took on the concept of oncology skincare. So I've just been there over a year. So I feel really blessed that it's the start of rolling this out so everyone can have access to someone like me to help them through. But what I would like to offer is a free consultation to everybody and 20% off of treatments up until the end of February 2023. Can't believe we're saying that. And I'll give everything to Shine to put that out. So you can all have that information and be able to contact me to arrange that. My clinic is in Harley Street, and yeah, so that's where I'm based. It's quite central and easy generally for people to get to. But I'm also quite aware that sometimes, you know, you just want a video conversation, this happens and that happens, and I'm really here to support and for all those things, because at the end of the day we want to live and feel as well as we can. So I'm here to obviously offer that as well, so kind of support the whole way through. So yeah.
Thank you. And just a quick question, if people aren't close to London, do you offer consultations? Is it possible to do this kind of thing over Zoom or?
Yeah, I can do it online. Yeah, all I really need from you is a list of what medications that you're on, and any surgeries that you've had. So like when I started, it was, you may come in for the same title of treatment, so a holistic facial, but you could actually receive something completely different from each other. And by having all of that, it means that I can make it really personalized. I don't want to give you a superficial treatment. I want you to have real skin results. And so with that information, I'll be able to do that.
Yeah, that's
Yeah.
fantastic. Thank you so much.